And now to health matters. Operatives of the National Agency for Food, Drug Administration and Control, NAFDAC, arrested a syndicate that specializes in the production of counterfeit wines, soft drinks and other consumables in Eziukwu Market in Abia State. This was revealed by the Director General of the agency, Professor Mojisola Adeyeye, in Abuja. She said NAFDAC carried out several weeks of intelligence gathering and collation of data on the activities of these merchants of death in collaboration with other security agencies. The NAFDAC boss said that the agency carried out the sting operation in the market to burst the criminal operation taking place there. According to her, it is worthy of note that this dastardly act has been going on for a long time and they operate like a cartel, threatening anyone who dares to challenge them. And to talk about these, I'm being joined live on the news by the President, Association of Resident Doctors, Abeokuta Chapter, Dr. Adewumi, Babatunde, Enoch. Good morning, glad to have you join me.
Hello, good morning. It's nice to be here.
Okay, now from a public health perspective, what are the potential health risks associated with consuming counterfeit drugs and food products over a long period of time?
All right, so the one I would like to talk about it in the short term and the long term period. So in the short term period, we could have things like diarrhea, vomiting, there could be irritation of the guts. People could react to some of these products. You know, some people come to the hospital sometimes, and we do not even know what is happening to them because we do not know that they probably consumed some of these dangerous substances. So in the short term, they could have some of these reactions to these and could cause a myriad of symptoms in them. In the long term, it could cause chronic kidney disease. It would cause damage to the liver, and a lot of people could develop some diseases of unknown origin that cannot be explained due to prolonged exposure to some of these substances. Because our body has a level to which it will take toxic substances and before it reacts to them. So once we have these substances accumulating in our body, the liver and the kidney tries to detoxify the body, tries to cleanse it, but the more we consume them, the more damaging they do to our body. When you look at those videos that was released by NAFDAC, you will discover that the environment with which they are doing these things are very dirty environments. The waters they are using are very dirty water. The place does not even look like a place where somebody could even sit down and eat, not to talk about producing substances where people would drink for a long time. So we are not even sure of how preserved these these drinks are. We are not sure of the kind of chemicals they are using. So the possibilities of damaging the body is limitless when it comes to the use of these, the consumption of these substances that are being produced by these people.
But what roles do resident doctors play in raising awareness, for instance, about the dangers of counterfeit consumables within their communities?
So resident doctors are like the frontline health workers because resident doctors contain house officers, medical officers, and the residents themselves. So we are the front line. We are the first point of call when any patients come to the hospital. We are the first people to see them, and we talk to them, explain to them the dangers of using anything that is counterfeit or fake. We also conduct medical outreaches. Every chapter of the Association of Resident Doctors during our AGMs and our OGMs conduct medical outreaches, and we go out to people to talk to them. We also go on TV like this and do radio programs to sensitize people about their health in general. So we do this on a daily basis, and we ensure that we tell our patients what is right. With this epidemic now, we are sure to tell our patients the things that they are supposed to do and the things they are not supposed to do to ensure that their health are being checked. And we have a lot of resident doctors who are out there on social media enlightening people, telling them about the dangers of consuming dangerous substances and how to ensure that their health is well protected. So the resident doctors are the front line. We are the largest body of doctors in Nigeria, and we are doing this.
If I may just quickly chip in there, Doctor, beyond your own awareness that you do, at your own, place of work. How about collaboration with regulatory agencies like NAFDAC in safeguarding public health against counterfeit products?
Yes, resident doctors are absolutely open to collaborations, and you'll be sure that we'll be reaching out to all agencies that are involved to see how we can go around and talk to people. Resident doctors are always open to collaborations, and since we have the numbers, we'll be open to helping out to ensure that we spread the news to people, and then we can get to the grassroots and ensure that the danger or the damage that is done is limited.
Now, let's talk about public enlightenment. What measures do you think should be taken, to enhance public education on identifying and avoiding counterfeit consumables in a way to mitigate health risks?
All right. So when we talk about public enlightenment, it's not just basically about TV and radio. It needs to start from the grassroots. It needs to start with talking about these things in languages that people understand, using the local dialect. It goes to talking to the community leaders, to the religious leaders, to everybody who is a stakeholder, to everybody whose opinion matters in every community. We need to reach out to all the people that matter and ensure that these people are also advocates. This is not supposed to be limited to just doctors or to journalists alone. Everybody needs to put their hands on deck to ensure that we spread the news to everybody. Everybody needs to be able to reach out to one person or the other. Anybody listening now should tell people when you want to buy drugs, when you want to buy drinks, when you want to buy anything that you are going to consume, ensure you go to a reputable store. This is not the time for us to buy from hawkers around the streets. Yes, I know this is going to affect the business of some people, but it's better to be safe than sorry. So enlightenment goes beyond just radio, television, social media. This is the work of every Nigerian right now to enlighten everybody. Everybody must hear about this. Everybody must be on their toes, and we need to do this as soon as possible.
Now, Dr. Adewumi, it's Youth season, which comes with lots of eating and drinking. What should be the first point of call for someone who may have consumed a fake drink?
So the first point of call should be the hospital, and it should not be just any hospital. It should be a teaching hospital or a general hospital at least. This is where we have the specialists who are going to look at you and know what damage has been done. Anybody who is coming to the hospital who are suspected that they are taking any substance that is fake, they should bring that substance to the hospital so that it can be tested. And like I said, it should not be just any hospital. It should be a teaching hospital, a federal medical center, or at least a general hospital. This is not something that the primary healthcare center can manage, or a small private hospital. This has to be specialized care. It is an emergency, and we need to treat it as such.
All right, thank you so much for your expertise on the news, Dr. Adewumi Babatunde, Enoch, President, Association of Resident Doctors, Abeokuta chapter. Thank you once again.
It's my pleasure. Thank you.